Vitamin B12 is part of the vitamin B complex, sometimes referred to as the pain-killing vitamin. It helps DNA protection, cardiovascular support, and energy metabolism. Vitamin B12 is an important marker to monitor, especially if you haven't been leading the best lifestyle or if you have a chronic health condition. Vitamin B12 is referred to as cobalamin, and it's a water-soluble vitamin. It contributes to the successful synthesis of DNA, the normal functioning of the nervous system, and the production of energy. The liver is the main site of storage of B12 in the body, and humans can obtain it from dietary sources, fortified foods, and supplements. It can take the form of cyanohydroxymethyl and deoxyadenylyl cobalamin. Cyanocobalamin is the most stable but unnatural form of B12. It's most commonly used in supplements, and it doesn't have a direct cofactor role in cellular metabolism. The most biologically significant form of B12 are methylcobalamin and coenzyme B12, or 5-deoxy-5-adenylyl-cobalamin. Vitamin B12 was considered the pain-killing vitamin in some countries back as far as the 50s. In the vitamin B12 blood test, the normal range is between 200 and 900 nanograms per milliliter. Intramuscular B12 at 1 mg per day for 12 days with lifetime monthly injections is an effective treatment for congenital vitamin B12 malabsorption. Oral or intramuscular B12 supplementation can prevent and treat a B12 deficiency of different origins. The high oral doses of 650 to 1032 micrograms per day can be equally effective to the intramuscular treatment, even in cases of pernicious anemia or malabsorption disorder. However, more severe cases with symptoms of nerve damage might require prompt intramuscular treatment. Hydroxycobalamin intravenously is likely effective for cyanide poisoning due to inhalation, ingestion, or skin exposure. This treatment has been approved by the FDA, including cyanide toxicity treatment in pregnancy. A B12 deficiency can cause an excess of homocysteine, and this is a proven risk factor for cardiovascular disease. Supplementation with B12 alone, or in combination with folate and B6, can successfully reduce homocysteine levels. According to clinical research, methylcobalamin treatment reduces pain symptoms in neuralgia, diabetic neuropathy, and lower back pain. The injected methylcobalamin, a form of B12, reduces the clinical symptoms in legs such as paresthesia or an abnormal sensation like tingling or pricking, burning pains and spontaneous pain in some patients with diabetic neuropathy. A meta-analysis of 7 clinical trials confirmed its moderate benefit for some symptoms of diabetic neuropathy, including pain. In one study, the methylcobalamin significantly improved the symptoms such as pain and the prickling sensation in the patients with neck pain. It appears to be safe and effective for nerve pain due to herpes simplex infection, according to 2 clinical trials on 178 patients. The methylcobalamin improved different types of neuropathic pain in animal models. It increased the regeneration of axons, and it promoted neuronal repair. Higher homocysteine and a decreased B12 level has been associated with an increased risk of age-related macular degeneration. One study involved 5,442 older women who'd been taking B6, B9 and B12 for 7 years, and the study found a 34 to 41% decreased risk of macular degeneration when supplementing with these B vitamins. Further clinical studies should investigate the effects of B12 alone for macular degeneration. In a randomized trial performed on 200 patients with depression and low normal cobalamin levels, the cobalamin supplementation improved depressive symptoms when added to a standard treatment. A review of 11 studies found prolonged supplementation with folate and B12 for several weeks to years may decrease the risk of depression relapse in the long run. Short-term effects were insignificant. Topical cobalamin improved the symptoms of atopic dermatitis, such as a skin rash, redness and itching, in 2 clinical trials on 70 patients. It was effective and well tolerated in both adults and children. Larger clinical trials are needed to confirm the benefits of a topical B12 for the atopic dermatitis. Cobalamin may have a role in the prevention of disorders of brain development and mood disorders, as well as Alzheimer's and vascular dementia in the elderly. A meta-analysis of 68 trials found Alzheimer's disease patients have significantly lower B12 levels. Additionally, they identified elevated homocysteine as a risk factor for Alzheimer's. According to one study, taking vitamin B12, B6 and folic acid for 2 years may slow down the brain atrophy in areas associated with cognitive decline and Alzheimer's disease in some patients. In a trial on 126 patients, the majority of cases with a primary circadian rhythm sleep disorder responded well to B12 supplementation and bright light therapy. However, patients with a secondary sleep-related disorder due to another health condition didn't respond as well. The response was variable in another study on 106 patients with different types of sleep-related disorders, but most groups experienced mild to moderate improvements. On the other hand, methylcobalamin at 3 grams per day had no beneficial effects on 50 patients with delayed sleep phase syndrome. According to the available clinical evidence, the B12 supplementation might not help with cancer risk, stroke risk, or cataracts. Foods that contain B12 are liver, clams, sardines, steak, trout, tuna, salmon, eggs, milk, shellfish, nori, and mushrooms. When it comes to nutritional yeast, only fortified products contain B12. Despite some misleading claims from the supplement manufacturers, yeast doesn't naturally contain any form of B12 that our bodies can use. The long-term consequences of less severe B12 deficiency are not fully known, but they may include adverse effects on the nerves, heart health, mental health, and cognition. B12 deficiency may be associated with infertility and miscarriage in some women. A B12 deficiency causes excess homocysteine, and this is a proven risk factor for cardiovascular disease. Individuals with a B12 deficiency have a higher prevalence of cardiovascular risk factors such as heart failure, stroke, and diabetes. B12 plays an essential role in the production of the red blood cells, and low red blood cells can indicate a B12 deficiency. Weakness and fatigue can result if your red blood cells are low, since you're not getting enough oxygen to your tissues. A blood disorder that results from a B12 deficiency or malabsorption is called pernicious anemia. Low levels of B12 have been linked to depression, Alzheimer's disease, and other types of cognitive and mental impairment. Multiple studies show B12 deficiency in the elderly can increase the risk of weakness, frailty, and disability, and increase a hospital stay. With regard to bone health, some studies show B12 deficiency is associated with lower bone mass. Although rarely, a B12 deficiency can cause blurred vision and eye pain. This can occur when untreated B12 deficiency results in damage to the optic nerve. About 6% of people in the US, aged 60 and older, are clinically B12 deficient, while about 20% have technically normal levels, 148 to 221 picomoles per litre, but these are far from optimal. A B12 deficiency increases with age, from about 1 in 20 among people aged 65 to 75 years to 1 in 10 or even greater among people aged 75 or older. Other people at risk of a B12 deficiency include people on a vegan or vegetarian diet, people with anemia, people with gastrointestinal disorders like Crohn's disease or celiac disease, and those who've had gastrointestinal surgeries. Pregnant women require higher levels of B12 to prevent birth defects, over 300 milligrams per deciliter. Infants born to a B12 deficient mother or receiving deficient amounts of animal source foods are susceptible to a deficiency between the ages of 6 to 12 months. Some patients with type 2 diabetes who are prescribed metformin might be at risk for a cobalamin deficiency. Proton pump inhibitors or histamine 2 receptor blockers like Zantac and Tagamet can lead to a B12 deficiency as a result of poor absorption. Hormonal birth control like oral contraception and DMPA among females can cause reduced B12 levels. The TCN2 gene is related to B12 deficiency and is associated with autoimmune gastritis. To book a consultation or to learn about herbs, supplements and natural treatments, check out my website.